This is your News Source Evening Bulletin for today, Wednesday, the 22nd day of April in the year 2020. I'm Gordon Mosley. Here is what we're tracking tonight. The Deputy Chief Medical Officer of the Ministry of Public Health, Dr. Karen Boyle, is sounding an alarm that Guyanese need to get their act together if the country is to really beat the coronavirus soon. In a telephone interview this afternoon with News Source, Dr. Boyle said too many persons are still being irresponsible by not following the guidelines put out by the health authorities, especially when it comes to avoiding public gatherings.
I'm a little disappointed. I mean, some people, some workplaces are definitely doing what was asked, and I'm proud of them. But there are the elements who still drinking on the roadside and, having unnecessary, these big strappy men with plenty muscles, with little bird, this thing in the cage, meeting on road corners and doing that nonsense still. Those kinds of things are not necessary, and that is unnecessary social interaction that could expose people to stuff.
Although Guyana has put in place a partial lockdown and curfew, many persons have still been spotted liming at the drinking spots and in the marketplaces, forcing the police to be conducting raids. The Deputy Chief Medical Officer explained that a time may be approaching when the authorities might have to become even tougher with sanctions.
I suspect that if we don't get our act together, as in the people get their act together and really understand their social responsibility, then I guess there may come a time where the government may have to look at, tougher measures, I guess. My worry is this period may finish and if we don't achieve our objective, being able to contain it. I know already, without us having finished, we are already seeing some improvement, drastic improvement.
But now medical officials are also facing an additional headache, with many of the persons who have been tested positive for the coronavirus refusing to provide information about their contacts and places that they might have visited in the lead up to their positive test. That problem is creating a major hurdle for the Public Health Ministry in its efforts to fight off the viral disease.
Those cases that we have, those persons who we know had corona, you wouldn't believe how difficult it is to get them to cooperate with sharing the names of their contacts and the places they went to. I don't want to say it's selfish, but for some reason, they're not forthcoming with that information, and that makes our job of containing spread so much more difficult when we don't know where to look in terms of who are the persons that may have come into contact with these cases and maybe the next potential case. That is the only way to stop spread, is to get there before the person manifests and put them in quarantine. And if they manifest, they've already been quarantined, so they didn't get to spread to somebody else. That is the way to stay ahead of the disease. But if we deny that information, then it really weakens our ability to do what we're supposed to do and what we can do.
Dr. Boyle said health officials are also faced with some contact persons also refusing to cooperate with them when they have been identified by those affected as possibly being exposed. Dr. Boyle reminded that the fight against the coronavirus is a national effort, and therefore everyone must take it seriously and do their part and play their role to assist the health workers. Guyana has recorded 67 confirmed cases of the coronavirus, with 7 of those cases resulting in death. The first case in Guyana was recorded on the 11th of March. More news coming up in a moment.
Parents and guardians, you are encouraged to tune in to the Guyana Learning Channel, Cable 29 or Channel 42 for daily educational and interactive learning sessions. The nursery program airs from 6 hours to 9 hours. Primary programs from 9 hours to 12 noon. We also air informative documentaries from 12 noon to 13 hours, and our secondary level programs are aired from 13 hours to 15 hours. Please continue to listen to our radio broadcasts. The interactive radio instruction for grades 1 to 3 daily on Voice of Guyana from 9 hours 30 to 10 hours for grade 1 pupils, from 10 hours 30 to 11 hours for grade 2s, and 13 hours to 13 hours 30 for grade 3 pupils. Please remember to tune in to benefit from these educational opportunities. A message from the Ministry of Education.
GBTI is your Guyanese bank, a bank that understands every customer's unique needs, opportunities, challenges, and financial concerns. At GBTI, we see you for you. Whether you're buying a new home or car, planning your next vacation or retirement, saving for your child's future, or whether you're ready to take that bold step of investing in your dream business idea, we are with you every step of the way. We hear your stories and watch you focus on your dreams as we share your aspirations. We are more than just banking. We are a family. We are part of your community. Our commitment extends way beyond the walls of our branches and is demonstrated every day in the opportunities we provide to our individual and business customers. The support, time, and commitment we give back to communities across Guyana to help improve the lives of our Guyanese families. Because we see Guyana through your eyes.
Fuel it up and drive, Super 95. Tune up. Fuel it up and drive, Super 95. Tune up. Protect your fuel system, boy. High mileage and performance, boy.
Guyoil's Super 95 gasoline gives you more reasons to drive and is available at 56 service stations nationwide. For affordable price, high performance, and high mileage, choose Guyoil's Super 95 gasoline.
Fuel it up and drive.
Tired of long lines? Register with MyGTT at mygtt.co.gy. That's mygtt.co.gy to view and pay your bills from anywhere. Enter to win an Amazon gift card worth $25 or a bounty voucher worth 5,000 Guyana dollars when you sign up today. GTT, do more.
The following is an important message from the Ministry of Public Health. The National Public Health Reference Laboratory is the only authorized facility with the capacity to test for novel coronavirus or COVID-19. The laboratory provides the specific procedures for collection of samples and can also request for testing to be done. Persons who need to be tested can fall within the following categories: those with acute respiratory illness, persons with a travel history to countries reporting local transmission, and persons who have been in contact with confirmed cases, along with other clinical outlines. The Ministry of Public Health has a hotline to provide information on the coronavirus. The public can call 227-4986, extension 215, or 624-3067.
Welcome back. Guyana has not recorded any new case of the coronavirus over the past 24 hours, but the National AIDS Program Secretariat is concerned about the risk facing persons who may be HIV positive and not on any treatment. In a recorded message today, the director of the National AIDS Program Secretariat, Dr. Rhonda Moore, explained that HIV positive persons are at an increased risk of contracting the coronavirus, especially if they are not on any treatment for HIV.
If you are living with HIV, and you are not on treatment, or you are not virally suppressed, you are at increased risk of developing the most severe form of this disease, which will require hospital stay and in most cases, ICU care. It is also very possible that you may die.
She said the HIV virus attacks the immune system, making it difficult for the body to fight off any infection, including the coronavirus. Dr. Moore said persons on treatment should continue with their treatment for HIV with advice from their doctors, as they also follow the guidelines to protect themselves against the coronavirus.
If you have never used treatment for your condition, I encourage you to call the hotline at 227-8683 extension 215, and we will direct you to the nearest treatment center in your region. If you are on treatment before but stopped taking it, please visit your treatment center to be restarted on your treatment. This is how you can help us to help you.
there are more than 8,000 Guyanese living with HIV. While the figure has seen a steady decrease over the years, there was some worry last year that the number of new infections was on the rise. Dr. Moore said it is important for persons who are HIV positive to take the coronavirus seriously, since the use of their HIV treatment would ensure that the virus is under control and therefore allow the immune system to fight other infections like the coronavirus. The director of the National AIDS Program Secretariat said the unit remains open to offer guidance and assistance to HIV patients during this time. She said persons should stay home unless it is absolutely necessary for them to go out, and they should follow an exercise routine and also ensure they maintain a healthy diet.
For all of you who need additional support for that balanced diet I mentioned earlier, the National AIDS Programs Secretariat Food Bank is prepared to work with your treatment site to provide you with food hampers.
HIV positive persons should also avoid smoking and the use of alcohol and those party drugs, the National AIDS Program Secretariat has warned. While scammers are taking advantage of the fears of the coronavirus, and the Guyana Telephone and Telegraph Company is warning its customers tonight to be aware of several scams against the company. GTT's Public Relations Manager Jasmine Harris today revealed that the company has received a number of queries and reports from customers over the past week on whether the company is distributing care packages at a cost of $3,000. The company has no such offer.
If you have any queries or you need to confirm any of the promotions that we have ongoing, you can go to our promotions website page, which is gtt.co.gy/promotions, and you'll be able to see all the promotions that we have going on at this time. Or if you have any other queries, whether it be about a scam or anything you want to just confirm, be sure to call 0488.
And the GTT public relations official also said the company has received information about persons pretending to work at GTT, attempting to pick up monies from customers to pay their bills for them. GTT said there is no such offer either.
It has also come to our attention that persons are offering to pick up monies on behalf of GTT to pay a customer's bill. We'd like to inform you that we do not have a system like this in place, and we have established ways for you to pay your GTT bills, which include MMG, your personal MMG account, MMG agents all around the country. We've also partnered with Hero Card and One Card, and they're actually the only authorized persons who can come to your home and pick up monies. It's very disturbing that fraudsters will take advantage of persons, especially during this vulnerable time. I'm asking the public, please do not fall prey to these scams. GTT will never ask anyone to pay for acts of kindness from the company.
The official said while the company has distributed COVID-19 care packages to cancer patients and care providers through the Georgetown Hospital and the Beacon Foundation, it has not indicated any intention of doing same for the public at this time. Turning now to the aviation sector, domestic airlines are facing some financial turbulence over that decision by the Guyana Civil Aviation Authority to suspend all service to bordering locations. In a statement today, the Aircraft Owners Association said domestic carriers are facing a more than 50% reduction in all flights because of the move, and it has left companies struggling to stay in business. The Aircraft Owners Association of Guyana expressed worry this afternoon about statements coming out of the Civil Aviation Authority of Guyana about some domestic operators increasing airfares. The local operators said the GCAA should have checked the facts before offering a comment that is hurtful to the industry. The Director General of the Guyana Civil Aviation Authority had described reports of fares being increased to some hinterland locations as unconscionable and unscrupulous. But according to the Aircraft Owners Association, its members have not increased their fares. And with the many restrictions in place, the removal of the value-added tax from domestic domestic flights is having no real impact. Members of the association have indicated that since the advent of the coronavirus pandemic, they have introduced stringent protocols to ensure the safety of passengers and crew, including 100% temperature testing of all passengers and staff, sanitizing of the aircraft before every flight, the compulsory wearing of face masks and hand sanitizing before passengers and crew board the aircraft. The statement said all cargo is similarly sanitized. The association said in spite of those strict precautionary protocols being applied, the COVID-19 task force has further enforced a 50% passenger restriction on all domestic flights, and that is adding more burden to their wings. Turning now to the police blotter, a fight between a group of inmates at the Lusignan prison's holding bay has left a 30-year-old remand prisoner dead. Prison authorities have identified the dead prisoner as 30-year-old Jason Dundas. Police investigators were called in to probe the murder. A statement from the police last evening indicated that there was a scuffle among inmates, and Dundas's body was brought out by some of the inmates after the fight ended. The man's body and face bore multiple injuries. He was taken first to the prison's infirmary before being rushed to the Georgetown Hospital, where he was pronounced dead on arrival, according to the police. Investigators have been questioning some prisoners about the fight as they try to figure out who may have been responsible for the man's death. According to the police, Dundas was awaiting trial for the possession of narcotics for the purpose of trafficking. He was charged last year after being busted with more than 90 pounds of marijuana. His murder came one day after 4 prisoners escaped from the Lusignan prison holding bay, the same holding bay. Those 4 escapees are still on the run. Across the region is coming up next.
Wondering how you can access free learning materials for your children? Parents and guardians, please visit the Ministry of Education's website at www.education.gov.gy to access textbooks, past papers, and practice tests to keep your child engaged in continuous learning. When you have accessed the site, go to the Students tab, wait for a second, and choose the appropriate option. You now have access to the resources you need. You are encouraged to take advantage of this opportunity as we strive to provide the best education for the nation's children. A message from the Ministry of Education.
They've made a positive impact on the heavy-duty transportation industry in Guyana since they've arrived. Guyanese are amazed at their power, durability, efficiency, and superior handling capabilities. These are brand new trucks, manufactured in partnership with German, Italian, and French companies. They have a powerful reputation for operating under very adverse Guyanese conditions and come with full after-sales service and spare parts. They're the most sought-after trucks today, with over 500 units in Guyana, and they're available in over 100 countries, including South America and the Caribbean. Be smart. Buy brand new ST Howa trucks today. Call 608-4998 and arrange for an inspection at ST Truck Guyana Incorporated, Block B, Public Road, Covenant, East Bank, Demerara.
We are legions of men standing strong, but never too proud to stoop and help someone. We must send a clear signal to all. Do right. Walk in upright ways, knowing that's what being a man is all about. And ever aware that things will only get worse when good men do nothing. Stand strong. Be the one to live right.
Falls, a trademark of China's Zhanghao Incorporated, located at Land of Cane in East Bank, Demerara, was incorporated in April of 2013, with over $10 billion Guyana dollars invested in a state-of-the-art 100,000-barrel fuel storage facility, a modern service station, an office complex, and a modern wharf that can berth international vessels. Having no association with any other fuel company, Falls imports its own fuel, which meets quality specifications, has all the legal permits, and is in compliance with international requirements. Its bulk facility can load 8 trucks simultaneously at a rate of 1,000 liters per minute, while the service station can service 12 cars at a time using computerized fuel pumps, which can facilitate the use of ATM cards. Through its professional team of mostly Guyanese, Falls wholesales and retails fuels to the public, including farmers and miners, and will continue to positively contribute to Guyana by providing quality products, service, and attractive prices. Try Falls today for all your fuel needs.
The following is an important message from the Ministry of Public Health. When should you use a face mask? A medical mask is not required for members of the public who do not have respiratory illness symptoms. Wear a mask if you are coughing or sneezing constantly. For healthy people, wear a mask only if you're caring for a person suspected to have COVID-19. Masks are only effective when used in combination with frequent hand cleaning with alcohol-based hand rubs, sanitizers, or washing with soap and water. If you wear a mask, dispose of it properly. The Ministry of Public Health has a hotline to provide information on the coronavirus. Members of the public can call 227-4986 or 624-3067.
Across the region right now, we begin in St. Lucia, where there's good news. The Chief Medical Officer there, Dr. Sharon Belmer-George, has announced that all of St. Lucia's coronavirus patients have fully recovered. To date, all of the positive cases of COVID-19 in St. Lucia have recovered, she said, with the remaining 2 cases who were in isolation receiving negative COVID-19 test results, and they've since been discharged from the hospital. This now places St. Lucia at a 100% recovery of all COVID-19 cases. Among the 15 cases St. Lucia recorded were individuals who fell within the category of high risk by virtue of some being elderly as well as living with chronic illnesses. They too recovered well, with no implications or needed critical care. Let's tell you now that the director of the Pan American Health Organization, Dr. Carissa Etienne, has called for accelerated and expanded testing for COVID-19 in countries of the Americas. She said countries in the Americas need a clearer view of where the virus is circulating and how many people have been infected in order to guide their actions. According to PAHO, as of the 20th of April, there have been 839,119 confirmed cases of COVID-19 and 42,686 people have died in the Americas. The director of PAHO said that countries have been prepared to test and detect cases of COVID-19 since before the pandemic was declared. Since February, PAHO says it had trained and equipped laboratories for PCR testing in more than 30 countries in the Americas. And finally tonight, international news. A second wave of the coronavirus cases in the U.S. could be even worse than the first, the country's top health official has warned. Centers for Disease Control and Prevention Director Robert Redfield said the danger was higher as a fresh outbreak would likely coincide with the flu season. He said it would put unimaginable strain on the U.S. healthcare system. The U.S. has seen more than 800,000 cases of the coronavirus, the highest in the world. More than 45,000 people have so far died with coronavirus across the U.S. California had its highest one-day rise in new cases on Monday, while New Jersey, the worst-hit U.S. state apart from New York, saw its highest increase in deaths in one day. And that's your News Source Evening Bulletin for tonight. I'm Gordon Mosley reporting. Stay safe.